That scene in the movie The Graduate where a businessman advises Dustin Hoffman on a popular career choice at that time with just one word? The word is plastics. That word could apply today with an entirely different meaning, namely the popularity of plastic surgery. Baby boomers have created another boom, this one in plastic surgery procedures. Dr. Bram Kaufman is here to talk about the most often asked for options. Dr. Kaufman is a plastic surgeon with Metro Health. Welcome to the show.
Thank you for having me.
So we think of cosmetic surgery as something to make you, look better or enhance it or something, but it's not only just that, right?
No, in fact, lots of the procedures and treatments that we prescribe address functional as well as aesthetic concerns.
Okay.
So for instance, in eyelid surgery, of course, doing a blepharoplasty or eyelid surgery will make you look better, but it also can take the weight off of your eyelids. It can help you see better. The same scenario, same kind of thing happens with, for instance, rhinoplasty or a nose job. If you've had a fractured nose and the nose doesn't look so good, you can fix it. It looks better, but it also may help you breathe better.
So when it's medical behind it, does that help insurance cover it?
Often, insurance will cover certain procedures or treatments that do result in a functional deficit. For instance, loss of ability to see in the upper fields in your eye frame.
Or breathe.
Or breathe through your nose, exactly.
I know there's lots of areas of different kinds of plastic surgery, but we're going to stick to the face. And as I understand it, the eyes have it. It's a real popular area, right?
Yes, the eyes and the upper third of the face succumbs to our aging process in a dastardly way, unfortunately. So a lot of the tissue in the upper part of the face, in the eyes, will droop as we age. And not only does the brow droop, where you can see the eyebrow is down, but the eyelid skin itself can droop, and that creates a visual field deficit. You can't see through that skin.
Right.
There's also muscles in the eyelid, and that's where some of the functional aspect of our eyelid surgery comes into play. The muscles elevate the eyelid, and when they stretch out as we age, then you have droopy eyelids. This is the photo you see on the screen now is a younger person where we just took care of the eyelid skin, and the photograph we saw just a minute ago demonstrates a more severe case where some of the muscles were addressed as well.
Okay, yeah, it can make a big difference on your eyes.
And it makes people feel better, and they feel younger, and they just can see a lot better.
Yeah. And our face also changes as we age. We just have to look in the mirror, see new wrinkles and this and that. But you say also that there's developmental changes in the face. What does that mean?
That's right, Laura. There's degenerative changes, and it affects all the tissues of the face. Obviously, we see our skin has wrinkles in it, but the skin gets a little thinner as we age. Soft tissue and the fatty tissue underneath the face sometimes atrophies or becomes less in volume, and you get that hollowed out, sallow look. Mm-hmm. Even the bones of the face change as we age.
Okay, so is there something you can do to help out those bones?
Well, in fact, one of the most common requested procedures is an office procedure, and that's using dermal fillers, and there are many commercial products available for that. The same concept is used for all of them. It takes up some of the volume that has been lost. And here in this photograph, you see an example of using a filler to fill in those nasolabial folds, or the folds that come from the nose to the mouth.
The creases that make you look like a bunny or something that come right here along the sides of your mouth.
That's right.
Huh?
And for instance, in this particular case, these photographs demonstrate lip enhancement. Often as we age, you'll see that our lips get a little thinner than we would like to see, and this can be an excellent solution for it.
But it doesn't have to be those big puffy lips like sometimes people made mistakes and got them.
No, the beauty of this is you can look at, it's in the office, you're awake. We do use some local anesthetic, but you can see the results right away, and you can say, stop. That's perfect, or you can say, keep going, I need a little more.
Okay. So you know kind of what you're getting into then. Are most of these procedures in the office?
surgical procedures are most often in the operating room. The filler procedures and those sorts of things are office procedures. They're very simple.
So you can really, in a day, just kind of really...
Short downtime, easy recovery.
All right. So if you're of a certain age, you may look in the mirror and not like everything you see. But thanks to plastic surgery options, like the ones Dr. Kaufman told us about today, you may be able to fix a few of your flaws with minimal downtime or discomfort. To find out more, use the information that's coming up next. My thanks to Dr. Kaufman for joining us today.
To learn more, call Metro Health at 216-778-7800 or visit www.metrohealth.org. Next, get more from your spouse's IRA.